Good evening. I'm deeply honored to be with you all and to be recognized by Project Access Northwest and the Andrea Castell Access to Healthcare Award. I want to thank Executive Director Gary Renville and your board for hosting this evening and inviting me to be a part of it. Many of you already are friends of Community Health Plan of Washington and Community Health Network of Washington. But for those who don't know us, I will give a brief introduction. Community Health Plan of Washington and Community Health Network of Washington were founded in 1992 by community health centers across the state of Washington in response to the need to provide access to quality health care and coverage for those communities that had traditionally been left out of the system and were being poorly served by traditional insurance programs. Community Health Network and Community Health Plan of Washington was created to address systemic healthcare inequities and to provide greater access to care. That's the whole reason we exist. Nearly 30 years later, Community Health Plan of Washington remains committed to making our healthcare system more equitable for all people in Washington state. We serve approximately 250,000 people across the state enrolled in our Medicaid and Medicare programs. We will soon be providing coverage for those not eligible for Medicaid through the state's new public option plan, Cascade Care Select. Community Health Network of Washington, our parent organization, is comprised of 20 community health centers across the state, and together these health centers serve over 1 million people and provide a critical safety net for low-income and uninsured populations. As CEO of both Community Health Plan of Washington and Community Health Network of Washington, I'm so proud of the important work we are doing to advance health equity and reduce health disparities by improving access to care for hundreds of thousands of Washingtonians. The reason I chose my career in healthcare is because I believe passionately that healthcare is a human right, and the system of healthcare in this country has traditionally failed those most in need. Throughout my life, I've been acutely aware of the harm inflicted upon people that lack power and privilege. This harm is not always the result of intentional discrimination, but it is often the result of lack of empathy and compassion. It is harm that occurs when we do not recognize the broader community that binds us all together. We have an obligation to care for one another as if we are all one community, one family. This belief is what led me to pursue my focus on changing the system to expand access to health and well-being for all people. I want to talk about that word access for a minute because it's central to the roles both our organizations play in Washington's communities. In this country, access to quality health care and in turn good health is so often income dependent. The COVID-19 pandemic has opened many people's eyes to the huge disparities in health and access to health care services because of poverty, race, ethnicity, and related systemic barriers to health and well-being. The fact that so many hardest hit by COVID are also the hardest hit economically is not surprising. Millions have lost access to health care or had limited access before the pandemic, and a disproportionate number of those experiencing these barriers are people of color. On the national level, from the 2018 National Center on Health Statistics, among adults aged 18 to 64, more than 25% of those who live in poverty or near poverty lack health insurance. And 8% of those above the poverty line also lack health insurance. As of 2014, 33% of Latinos We're uninsured compared with 11% of white people. We know that without coverage, people do not get the care that they need and too often receive their care in an emergency room. The American Cancer Society has stated that the greatest factor in deaths from cancer is lack of insurance coverage. Our experience in the state of Washington is much better than the national statistics because Washington has benefited from the Affordable Care Act and expanded Medicaid coverage to the low-income adults without dependent children. But even in Washington, we have too high a percentage of people who have inadequate or no healthcare coverage because they are undocumented or don't qualify for Medicaid or are uninsured or underinsured and cannot afford deductibles or out-of-pocket costs. And of course, the ACA continues to be under attack. And with the pandemic's hit on the economy, state and local programs are at risk as well. Many of Project Access Northwest clients are clients of Community Health Network of Washington's community health centers. Project Access helps fill those gaps for people who do not have access to Medicaid and Medicare. Together, we are working to make sure that people with lower incomes have access to affordable, quality health care that change lives. There is an Arabian proverb that says, "He who has health has hope, and he who has hope has everything." I am so honored to be with you as we celebrate Project Access Northwest and its founding staff member, Andrea Castell. I am humbled and honored to be given an award in her name as she has dedicated her life to bringing access to health and access to hope to so many people. We carry that hope tonight because our organizations exist and are fighting every day to provide healthcare to people marginalized because of their income levels, race, ethnicity, or immigration status. We carry that hope because we are giving and supporting providers in community health centers, free and faith-based clinics, local hospitals, and specialty practices who open their doors to our clients. And we carry that hope because people like Andrea and each of you gathered here are engaged and energized to ensure access to healthcare as a basic human right for all. Thank you.